Ethical decision-making is an essential aspect of being a certified nursing assistant. As a CNA, you will often find yourself faced with challenging situations that require you to make decisions that are morally and ethically sound. These decisions can have a significant impact on the well-being and care of your patients, as well as your professional reputation. In this section, we will explore the principles of ethical decision-making and provide you with guidance on how to navigate these situations effectively. Ethical decision-making is guided by a set of principles that help CNAs determine the right course of action in difficult situations. These principles include 1. Autonomy, respecting the rights and choices of patients. This principle emphasizes the importance of obtaining informed consent and involving patients in their care decisions. 2. Beneficence, acting in the best interest of the patient. CNAs should strive to promote the well-being and safety of their patients, ensuring that their actions result in positive outcomes. 3. Non-maleficence, avoiding harm to patients. CNAs should take precautions to prevent harm and minimize risks to their patients. 4. Justice, treating all patients fairly and equally. CNAs should provide care without discrimination and ensure that resources are distributed equitably. 5. Veracity, being truthful and honest with patients. CNAs should provide accurate information to patients and avoid deception. 6. Fidelity, being loyal and maintaining trust with patients. CNAs should uphold their commitments and maintain confidentiality. When faced with ethical dilemmas, CNAs can utilize various decision-making frameworks to guide their actions. These frameworks provide a structured approach to analyzing the situation and determining the most ethical course of action. Some commonly used frameworks include 1. The 4-step ethical decision-making model. Identify the problem or dilemma. Gather relevant information. Evaluate the options and consequences. Make a decision and take action. 2. The principle-based approach. Identify the ethical principles involved. Weigh the importance of each principle. Consider the potential consequences of each action. Make a decision based on the principles and consequences. 3. The ethical decision-making framework. Define the problem. Identify the individuals involved and their perspectives. Consider the ethical principles and values at stake. Generate alternative solutions. Evaluate the potential consequences of each solution. Make a decision and take action. As a CNA, you may encounter various ethical dilemmas in your daily practice. Some common ethical dilemmas include 1. Respecting patient autonomy, balancing a patient's right to make decisions about their care with their safety and well-being. 2. Confidentiality, maintaining patient confidentiality while also ensuring the appropriate sharing of information with the healthcare team. 3. End-of-life care, navigating complex decisions regarding life-sustaining treatments, palliative care, and advanced directives. 4. Resource allocation, making fair and equitable decisions when resources are limited, such as during a pandemic or in a resource-constrained healthcare setting. 5. Boundary issues, maintaining professional boundaries and avoiding conflicts of interest or dual relationships with patients. To navigate ethical dilemmas effectively, CNAs can employ the following strategies. Seek guidance. Consult with your supervisor, nurse, or other healthcare professionals to discuss the ethical dilemma and seek their guidance. 2. Consider legal and ethical standards. Familiarize yourself with the legal and ethical standards that govern your practice. This knowledge will help you make informed decisions. 3. Reflect on personal values. Reflect on your own values and beliefs to ensure that your decisions align with your ethical framework. 4. Consider the perspectives of others. Take into account the perspectives of patients, their families, and other healthcare professionals involved in the situation. 5. Document the decision-making process. Keep a record of the ethical dilemma, the options considered, and the rationale behind the decision made. 6. Continuing education. Stay updated on ethical guidelines and principles through continuing education and professional development opportunities. Ethical decision-making is a crucial skill for CNAs to possess. By understanding the principles of ethical decision-making, applying decision-making frameworks, and employing strategies for ethical dilemmas, CNAs can ensure that they provide the highest quality of care while upholding ethical standards. Please proceed to the